Question 1. Before helping a client into a bath or shower, the nurse aide should first A. Apply a moisturizer to prevent dry skin. B. Check the temperature of the water. C. Shampoo the client's hair. D. Soak the client's feet. Answer B. Explanation. Never let a client enter a bath or shower without checking the temperature of the water. The water should be warm, 95 to 105 degrees F, 35 to 40 degrees C. Test the water against your inner forearm. The flow or spray should be gentle and directed at the client's body to keep them warm. Question 2. When transferring a client to a different unit, the most important information the nurse aide needs from the nurse is the A. Client's medical diagnosis, B. Name and room number, C. Name of the client's spouse, D. Phone number to the client's room. Answer B. Explanation. Before transporting a client for any reason, always check the client's ID and verify where the client's going. For transfer to another unit, the nurse or the person responsible for the bed assignment should provide the room and bed number for the client. To ensure a smooth transfer, do not move the client until the information is confirmed. Question 3. An aide is pushing a resident down the hall with a wheelchair when a call line lines up. The aide should A. Push the patient to a safe place, apply the wheel locks and answer the call light. B. Continue pushing the patient and assume someone else will answer the call light. C. Put the patient back to bed and then answer the call light. D. Take the patient inside the room while answering the call light. Answer A. Push the patient to a safe place, apply the wheel locks and answer the call light. Explanation. Prioritizing and teamwork are necessary to give excellent patient care. If possible, stopping to respond to a call light after safely parking the wheelchair is the best action. The nurse aide can find out what is needed and ask another team member to follow up, or if it's an emergency, the aide can call for help and begin to assist the patient. Question 4. A resident weighs over 300 pounds and needs to be repositioned in the bed. The nurse aide should A. Tell the resident to wait until a strong person comes on shift. B. Get another nurse aide to assist in repositioning the resident. C. Advise the resident about the benefits of weight loss. D. Ask the nurse about getting a low-calorie diet order for the resident. Answer B. Explanation. Trying to move or transfer a heavy resident alone puts the nurse aide at risk for a back injury. Get assistance from at least one another person. Use a draw sheet to move the resident up or to roll them on the side. This avoids injuring the resident's shoulders and neck, as well as preventing skin damage from friction. Reposition is by pulling, not lifting. If the resident is able, ask them to assist by pushing with their heels. Question 5. You're giving mouth care to an unconscious resident. You must be especially careful to prevent the resident from A. Talking during procedure, B. Eating the toothpaste, C. Biting down on the toothbrush, D. Aspirating any fluid. Answer D. Explanation. When giving oral care to an unconscious client, place the client in a lateral side-lying position with their head turned toward you. The bed can remain flat or the head can be raised to a semi-flowers position with a lateral position. The fluids can drain out of the mouth into the mouth basin rather than down the client's throat. Aspiration can be serious, leading to pneumonia. Always have the bulb syringe available to clear the client's mouth as needed. Question 6. Which will not prevent pressure sores? A. Applying lotion to dry skin. B. Massaging and rubbing the skin vigorously. C. Repositioning or turning every 2 hours. D. Keeping bed linens clean, dry, and free of wrinkles. Answer B. Explanation. Pressure sores, also called bed sores and decubitus ulcers, develop when there is prolonged pressure on a part of the body that has little padding. Common areas are elbows, shoulders, hips, toe bone, and heels. Because the skin is delicate, it should never be rubbed or massaged vigorously, especially if it is reddened. This damages the tissue on the skin and contributes to the development of a pressure sore. Question 7. Which of the following will not assist bowel elimination? A. Taking a walk. B. Increasing dairy and sugar intake. C. Eating more foods with fiber. D. Drinking a lot of water. Answer B. Explanation. Bowel movements can be more regular by increasing fluid intake, as well as adding fiber from fruits, vegetables, and grains. Dairy products and sugary foods can cause constipation. Activity stimulates the bowels too. If the client has fewer than 3 bowel movements a week, or the stool is hard and difficult to pass, the client may be constipated. Question 8. A resident's dentures should be stored in A. A paper towel near the sink. B. Several tissues at the bedside. C. A labeled cup with cold water. D. An amethyst basin in the bathroom. Answer C. Explanation. Dentures are important for the client's nutrition, as well as for their appearance and self-esteem. Handle dentures carefully because they are expensive to replace. After cleaning, place the dentures into a clean denture cup filled with cold water and label with the client's name. Do not place dentures in a tissue or paper towel. They could be accidentally thrown away. Question 9. A resident has refused to eat breakfast and lunch. The nurse aide should A. Force feed the resident. B. Report the situation to the nurse. C. Withhold snacks until the resident eats dinner. D. Ask the resident family to make him eat. Answer B. Explanation. As the frontline healthcare professional, the nurse aide may be the first to notice a change in the resident. If the resident refuses meals, notify the nurse. The resident's condition may require medical attention. Do not threaten or punish the resident. Question 10. While dressing a post-TVA resident with one-sided weakness, which arm should be put through the sleeve first? A. Both arms at the same time. B. Strong arm. C. It doesn't matter. D. Weak arm. Answer D. Explanation. When dressing clients with one-side weakness, teach the client to use their unaffected strong side to dress the affected weak side first. When getting undressed, take the unaffected side out of the sleeve first. Clothing should be loose-fitting and comfortable. Thank you for watching.